What you need to know before going in for your next Botox treatment, whether you're a first timer or whether you've been getting Botox for years, this is something that's going to make you a more educated patient. So you get the biggest bang for your buck. So you're getting a better treatment. I believe knowledge is power. So if you can understand the process of it, you're going to understand why you're getting it, where you're getting it, and thus going to hopefully be a better advocate for yourself. And from a cosmetic perspective, you're going to probably get a better result. This is part 2, so if you missed part 1, go back to my channel and watch part 1 first. And if you're new here, I'm Jordan Harper, board certified nurse practitioner. I've been in the medical field for over a decade, and I'm also founder and CEO of a results-driven skincare line called Barefaced. In this channel, we talk everything skincare, aesthetics, injectables, office treatments. So if that sounds like it's your vibe, don't forget to hit subscribe. I post a new video every week. One of the most common questions I've gotten as a nurse practitioner in the aesthetic industry is, when should I start getting Botox? And I think what we're seeing, especially online, is that people are getting it younger and younger. And honestly, that's not really necessary. I do believe in, and I'm a big proponent in, preventative Botox. However, while there's not a set age that you should start getting Botox, there are things that you can look for in the skin to know if it's a good time for you. So here's how you do that. So if you are looking at your face and you're noticing static lines, that means lines that are present at rest. So you're not actively furrowing the brow or lifting the brows or squinting, and you're seeing those lines present at rest. That's called a static line. That is a good time to start to consider getting Botox. And that's how Botox is really effective as a preventative measure, because once you start to see those lines etch in, if you start treating with Botox, they won't get deeper. And you've probably seen, and a lot of times you can look at your parents as an example. So I know for my parents, my dad has a very, very strong glabellar complex. So he actually has a line this way, which is a little bit more unusual. Most people have these 11s is what we call them. He has a very strong glabellar complex. Have I treated with Botox? Yes, because he's let me treat him a couple times, but it is so deep. You know, he's 70. The line is so deep, it's not going anywhere. So can we soften it at that point? Yes. But if you wait until these lines are deep and etched in, it is a lot trickier to treat them with Botox to get rid of them. I would say if you're starting to notice lines present at rest, that is a great time to consider getting Botox. And typically that's going to be when you're in your late 20s, early 30s for most people. I've had patients that are 37, not a line. It's not always age related, but I would say generally it's like late 20s, early 30s. However, everyone isn't their own individual. And so that's why like kind of assessing your own self to see, oh, are those lines present at rest or are they not? One of my best friends, we are the exact same age. She has never gotten Botox, almost 38 years old, and still doesn't even really need it. And it's because she doesn't have a really expressive face. And so some people can control their expressions. It's a learned process where you're not over lifting your face. You know who I think of a lot is Kourtney Kardashian. She is the type of person who, if you watch her, she's not overly expressive. So if you can like control your emotions, I personally can't. Botox has just been a part of my routine for fine line prevention for years because I cannot control my expressions. But if you can, and if you can prevent yourself from lifting your forehead too often, then that's great. And that's also just like gonna save you a lot of money over time. Baby Botox, what is it? This is kind of just a marketing term, and there's a couple of ways it's interpreted. And really, I would just think of it, if you're hearing baby Botox, it's just a way that you're more conservatively treating the face. It's kind of just like you're getting Botox a little earlier. Baby Botox also is just another way of thinking of preventative Botox. And so I personally don't like to think of it as just like a lesser dosage, because you want to be treating a muscle to correction. And so if you start baby Botox and you're just like doing tiny little doses, you're just not going to get the longevity. And then it's like, what's the point? What's the point of what I even did? And I do not like a frozen look. So I'm not saying freeze the face, don't let the face move. I think a natural, refreshed look is really great. And you can get that with baby Botox with the appropriate dosage. There is a common fear and a question that I get asked all the time is, does Botox atrophy the muscles over time? Yes and no. So let me explain. And this is where I think understanding what Botox is, and will probably encourage you to adhere to a Botox schedule that isn't so frequent. All of the research behind Botox and all of the recommendations on dosing and timing, that has all been done. We have the data for that. And so sticking with that schedule at a minimum, you never want to get injected before that 3-month window. And if you get Botox regularly, you're tempted to go in before 3 months because your movement starts to come back. So this is going to make probably more sense to someone who's gotten Botox in the past. For a first timer, just know that if you can just stick at least 3 months before getting an additional treatment, you're going to have better longevity and you're going to prevent that muscle atrophy over time. Because Botox, which is a purified protein that temporarily relaxes the muscle by by blocking the nerve signals. So it's basically not allowing the nerves to work. And so that's how you're not able to lift and make that expression. And that takes around that 3 months to have full activity again. If you get in a cycle where you're getting Botox every 6 weeks, that's when you can get muscle atrophy over time, when you're getting too frequent treatments of Botox. So that's why personally, I don't like to treat my patients any earlier than 3 months. And then for myself, I typically wait 4 months or 6 months. I kind of just wait until the movement fully comes back, because for me, I'm okay with the movement. I'm just wanting to prevent the fine lines from happening over time. For me, that 4 to 6 month window works really nicely, because that way I'm not letting those lines fully like etch back in. And because I've been getting Botox, I guess like 10 years now, I'm just more like on a maintenance cycle. The only time I break this rule, actually there's 2 times when I break this rule. 1, if you're my first time patient, I'm learning your face. I'm learning where, your mobility. Sometimes people have one brow that lifts higher than the other. They're just more hyper expressive on one side. You have to learn the face. Give your injector time to learn the face. Have come back 2 weeks after your treatment so they can kind of assess their work. This is really, really helpful for an injector, because that way they know for the next time, every time should be getting better and better. And after the 2 weeks, when I see my patient, I will do a little touch up if needed. Otherwise, I just take account to, okay, those injections worked, or that dosing worked for them. Now we know we'll continue to follow what we did the last time, because that was effective. And you're constantly like analyzing the face, because over time you're naturally aging and there's age-related shifts that are happening. So maybe you're adding dosing over time, or maybe you're adding locations over time. For example, I have added my right masseter over time just because I naturally clench so much harder. I chew food on that side. And so that muscle is getting larger over time. And then the other time when I will break the 3-month rule, if it's someone's wedding, that is the only times when I will say, okay, yes, I will treat you outside of this window. After that, I want you to wait 3 months before getting treated again. Those are the only 2 times. So 2 weeks after the first treatment, just to like make sure everything's looking good. And then if it's like about to be your wedding, and even if you're not due for a Botox treatment, even if it's too soon, that is the time when I break my rules. Let's talk treatment areas. You've probably seen this too, where someone's getting treated is the upper third of the face. That's between the brows, the forehead, and the crow's feet. These are softening these lines of expression, which tend to show up first on the aging face. Aging is a gift, so let's not minimize the gift of an aging face. So this is like your typical Botox treatment. And what I like to do for Botox for myself and for patients is to treat the full face. I actually think this gives a much more realistic result. And it's actually, again, going back to prevention, it's preventing some of these natural age-related changes. For example, the downward turn of the mouth. Now, if you can relax the DAO, which is the depressor anguli oris, with Botox, which is a muscle that goes from the oral commissure down to the mandible, if you can relax that with a couple units of Botox, you're going to prevent the downward turn of the mouth. Now, are you going to totally prevent it? No, but you can soften it. And over time, you just look, as we get older, the gravity pulls us down and we can have the RBF face. And so if you can just do a couple units, and I'm pretty strong in my DAOs, I'm actually really strong in my entire lower face. So you just do a little bit here, and I have a graphic in a video, and this is kind of like all the points that I touch when I treat the lower face. That's a really impactful area in the lower face, and it just takes a couple units, and I love that. Another area that I love is the mentalis, which is the chin. Now this muscle, again, look at older people, I am not making this up, we call it an orange peel, and it starts to get some texture irregularity. That's because the muscle, and I am telling you, women, we're just hyper expressive with our mouths, and so we tend to just curse our mouths a lot, and that starts to cause skin changes because the muscle underneath is controlling what the skin looks like. So if you can do a couple units here, you can just get a really nice soft look of the chin to prevent that cobblestoney orange peel of the chin. Another area in the upper face, and I personally actually don't like this on myself, but I have patients and friends who absolutely love it, and this is one of the things you just won't know until you try. Women, again, also are more prone to getting these fine lines around the mouth. Whatever, it's a part of it. If you can avoid drinking out of straws and you can be careful with over pursing your lips, you're going to notice less of them, but inevitably we're just more prone to them. So you can do a touch of Botox in the upper lip to soften those lines. The reason I don't like it is because it does make you talk a little funny. You'll notice, now that I said that, you'll notice someone and their lip just doesn't move normally, and I just always think I want to look normal. I don't really care about the age that I look. I want to take care of myself. I'm always going to pick normal over augmented or weird or whatever that is. And so, but I mean, again, that's a personal preference. And I also do a lot of stuff on camera. I see my face looking odd when I'm I've had it done twice, and it's I can't really talk. Not only does that soften the lines above the lip, it also gives you a little bit of eversion of the upper lip. Let me explain. We also call this a lip flip. By injecting a little bit along the lip line, it not only helps to soften or prevent those smoker's lines, you'll get them even if you don't smoke, it gives a little bit of lip eversion. I love this for someone who smiles like this. and they don't like their smile. You know, there's nothing wrong with smiling like this, but when I see patients, they come in and they're like, I think I want lip filler. You do not need to get lip filler. You notice your lip curls when you smile, you need Botox, because what's happening is that muscle is pulling too much, and so it's causing that lip to curl under. So before getting lip filler, because lip filler is not going to change. Lip fillers might fill it, but you're still going to curl your lip when you smile. So the first thing you need to do is get a little bit of Botox to relax that muscle. Then wait 2 weeks, reassess, then decide if you want lip filler. Now, another impactful place is if you have a gummy smile. So some people, you'll smile, maybe the lip doesn't curl at all, but you'll see a lot of gum when they smile. The thing that you have to be careful of is showing gum when you smile is actually very natural. Having a slight asymmetry to the smile is also very natural. And I'm always very focused on like preserving natural appearance, because, you know, we're humans and we want to look like humans. And the eye, you have probably seen enough people that you're like, something's off. You might not know what it is, but you can tell when something's off. And the goal is to like not look off. And so you want to preserve a little bit of gum when you smile, but you can do a couple units here and here. And that is going to help prevent, this is a muscle that helps lift the lip when you smile. And so if you can just relax a little bit, you'll show much less gum when you smile. And depending on the strength of that muscle, you just want to do a couple units. It can just give you a really nice smile without showing an excessive amount of gums. Moving right along, the masseter. That is a muscle of mastication, so what you're chewing. And you will see some people are more prone to this than others. And if you have temporomandibular joint disorder, TMJ, you might have an enlarged masseter. Like I was mentioning earlier, have one on my right side, and I don't know, I've had like off and on pain on my left side, so I just like naturally over the past 12 years have just chewed on this side, and over time this masseter has gotten bigger. Whatever, who cares? But it actually like starts to ache and feel sore, so I will treat my masseter with Botox, and it just helps to like me not to clench as much. And a lot of times if you're clenching a lot, it can also cause migraines. There's other reasons why you would inject the masseter outside of just for cosmetics. But think about Bethany Frankel, and here's her before and after picture here. She's a great example of how transformative masseter Botox can be on the face, because if you're starting to get really squared out, it can slim down, so it can give you more of that like heart-shaped face. It just softens your look. I think that's the best example of like what Botox should do. So it should keep you looking natural, but it should just soften your look. And what happens as we age, our look starts to get a little bit more like stern, and that's just because we start to get more fine lines, and a lot of these fine lines, they're from furrowing the brow. Moving down on the areas Botox treats, we're gonna hit the neck and then we're gonna be done. There's something called the Nefertiti lift, and it's actually really cool because it can help further contour your jawline. And so the way you do that, you do a couple units along the jawline, a couple units down here, and then you hit the platysmal bands, which let me see if I can do this. Mine are Botox, this is not a great example, but you can see a couple of them. So if you do this face like, you will see these bands. These are called neck bands, and you can inject these with Botox. And by doing this, so the neck bands, again, you can't fight gravity. They're going to be pulling down the face, and that can cause a little bit more like, you can lose a little bit of your definition of your jawline. So by relaxing those muscles, you kind of get the definition back. This is a before and after, but it's just really impactful, showing what the Nefertiti lift can do for jawline definition. The last little area that I have seen a lot of patients complain about is these necklines. My 5-year-old has necklines. Also, we're looking down at our phones. We're like not having good posture. We're constantly like creasing the neck. So part of that is just being a human. And a part of that is like, stop thinking that filters on Instagram, TikTok, whatever, are the way people actually look, because it's simply not. You can use a little bit of Botox injected very superficially, like ding, 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 like a little wheel, kind of like this. And you can do them across the entire kind of like neckline, neck area. And that can help the skin not to look as crepey, you not to be able to see that line. You can inject it with filler too, but that's a really nice way to like kind of smooth the skin. All right, that's it. Those are like all the areas that I would treat with Botox. There's also a lot more areas in the body that can be treated. I've seen trap Botox trending after like the Barbie movie. I mean, like the list goes on, but those are the ones that I think are the most impactful, depending on the results you're looking for and maybe the concerns that you have or want to prevent. Results that you can expect from a Botox treatment. If you're getting Dysport, it's going to kick in a little bit sooner. Botox is going to kick in a little bit later, maybe around 5 to 7 days. Dysport 3 to 5. And then full result for both of those is going to be around 2 weeks. And that's why I always recommend a first-time patient to come back in 2 weeks so you can reassess how the treatment went, because you're taking into account all the markings, all the dosing, and then you can see how effective that treatment was. Then after that, your results are going to be their absolute best around that 6 to 8 week window. And I know that seems small. You're still going to have great results at 2 weeks, but like as far as the longevity, we of course recommend don't treat before 3 months, but you are going to see like a bell-shaped curve. So it's like your Botox is kicking in, it's at its peak. So maybe that's around 6 to 8 weeks, and then it starts to taper down. So at 8 weeks, at 10 weeks, you will probably have more movement than you did 2 weeks ago. That is totally normal. But it is very common at that 8 to 10 week point to be like, I need more Botox. And that's when your injector needs to do you a solid and say, we will not inject you before 3 months. Of course, there are risks, limitations with any procedure. And again, Botox treats lines of expression. I've seen so many patients come in and they have sleep lines from stomach and side sleeping. I sleep on my side, so I am not here to shame you for that. It is like impossible for me to sleep on my back, but sleep lines will not be treated by Botox. So there are limitations. Botox treats lines of expression and it helps to relax muscles. And so that's really the responsibility of your injector to kind of guide you on like the limitations of like the areas that it's not going to be able to treat. As far as risks, of course, there's always risk to it not looking like you want. And like I was saying with the lip, some of these treatments you might not know that you like it or dislike it until you get it. I mean, sometimes it's just a part of it. And I know if anyone has come in and they have a heavier brow, you just want to be more lightly treating the forehead or avoiding it altogether. So those are just areas that like you can always have an uneven brow. There's a handful of risks, but I think, one, it doesn't last forever. I've had this muscle. So if you inject and you're not getting in this muscle and it goes here, you'll have lip asymmetry like this. I've had that. None of this stuff is permanent, but like there are risks, and I would just ask your injector to say like, okay, so if this doesn't take how I want, or if this doesn't look how I want, what's the solution here? And sometimes you're like getting these little lines up here right after. That's okay. That's really easy to treat. You can just add a couple units on either side 2 weeks later. But if you're heavy, it's always better to have more movement, because if you're heavy in the brow, that's tough to treat once Botox is set in, because that means there's been either it was like, maybe it was too much, or maybe the placement wasn't right, or maybe you just like your muscle responded in a way that was just flattened it out a little bit. That's harder to treat. So you want to be more conservative in areas where there's higher risk. And so that's why that coming back in 2 weeks is really impactful, because then you can see how the muscle responded. I recently posted this video on Instagram and I cannot believe, like, it went viral. It's probably my most shared, over like 20,000 shares or something insane. But taking zinc prior and post your treatment can actually improve the longevity of your treatment. I'll share the study here and it kind of gives you a breakdown, but it's zinc 50 milligrams and Phytase 3,000. I'm like not remembering exactly. Here's the study, screenshot it, look for that supplement. It can be really impactful to increase the duration of your Botox treatment, especially if you're not getting the longevity at once. Botox needs zinc to actually bind. So if you're getting Botox, you're getting the sufficient amount of units and you're still not seeing the results that you want, it's a very easy thing to trial. Does it work on everyone? Maybe not. So, I mean, this is one study, and are there flaws with potentially every study? Sure. I think this is a very like safe and easy thing to try if you're not getting the longevity you want from your Botox treatment. How to find an injector. With Botox and with injectables in general, your injector is even more important than what's getting injected, because they're dictating your treatment plan. You don't really even need to worry about what's getting injected if you have a good injector. And what I say is, of course, they're going to inform you of what they're doing and you're going to consent on it and they're going to walk you through the process. But if you have a good injector, you can feel a lot more comfortable trusting the process, because it's not really your responsibility at all to dictate your treatment plan. That's why we spend years and years and years studying this, continue education. There's constantly improvements in the aesthetic industry. There's constantly ways to grow. So your injector is really your most important person in this whole thing. Here's what I would do. If I was looking for an injector, and I'm very picky on who I choose as an injector, one, I would ask your friends where they get their treatments done. That's like just a very easy way. And if they like their person, if they don't, that's a great way to find an injector. Then what I would do is, once they recommend someone, I would look them up. I would look up their website. I would look up their Instagram. And if you see that their before and afters look, oh, okay, they look relatively normal. They shouldn't be standout, okay? They shouldn't be, when I say standout, they shouldn't be like, wow, her lips look so different. Wow. It should be like, wow, they look so good. I would look at their before and afters for sure. And then I would just kind of look at their general approach. If you see them bashing a bunch of people all the time, they seem very polarizing. I don't think that's your person, because you need to be open to seeing new things in the industry. And also, like, we're all learning in this space. There's so much new innovation constantly. And so just being open to learning from other people. And I just don't think you want anyone who's like very extreme. And then I would look at what they look like. If they look normal, that's a good sign. If they don't look normal and you want to look normal, I wouldn't go to them, because what that tells me is that they have a distorted perception of normal. They probably don't even care. And like, some people come in and they want the biggest lips. Great, that's great. Then go to that injector. But if you want to maintain a natural look, then you need to go to someone who also like looks normal and not overfilled and overdone. And that's your crash course on Botox. Don't forget to like and subscribe if you found this video helpful. And if there's anything I didn't answer, drop them in the comments below. Thanks for watching.